If we're out of capacity with doctors, the first question to ask is, what kind of things are doctors doing, right? Is the doctor spending the majority of their time doing things that only a doctor can do? All right? If you don't know, and it might be if you have multiple doctors that some are and some aren't. Right? And we often hear from newer doctors that they don't necessarily want to let go of these things because they're not confident in the skills of their team to provide the care as good as they would if they did it themselves. Sometimes we hear from doctors, it takes too long to train my team, it's faster if I do it myself. Okay? And if you hear that, or if you hear doctors saying that, guess what that is? That's a leadership failure. Right? It is. Okay? So again, it's often a matter of systems. What systems are we utilizing to train and develop our teams? What processes do we have in place? And what are your standards? This one kills me every time. Any dentists out there want to learn how to create implant surgical guides and 3D print them for pennies? I'll be teaching a hands-on course for design and printing of surgical guides, and there's doctors in the room that are like, hey, that sounds kind of cool, that sounds kind of exciting, but we're out of doctor capacity. And here we have an example of a bright, shiny object, right? Where doctors are like, yeah, I want to learn how to do that. I'm going to save money doing it myself, when they could be producing $800 an hour. Make sense? So don't get distracted. Doctors, again, if it's something you want to do because you love it, that's a different conversation. But if you're struggling to be productive and increase your own productivity, how many of these types of bright, shiny objects are in your way? How many of these do you welcome in on purpose because it's what the crowd is doing? Okay, so these are the tough questions you have to ask yourself, right? So where do we start if we don't know how well we're performing here? Doctors, a great place to start is ask your teams. What are some things that I'm currently doing that you could be doing? Okay, ask teams. What are things your doctor's doing that you could be doing? What are some things you'd like to learn? What are some things you could take off the doctor's plate if you only knew how to do it better? And what's awesome is team members often will rise up when given that opportunity. So when it comes to team utilization, we want to make sure that we're using the skill sets of each team member to their fullest potential. So where it's legal, obviously, hygienists can administer anesthetic. Now, like yesterday's example, we don't necessarily want the hygienists to leave their patients and administer anesthetics so we can search for vacations on Airbnb back in the office. Right? We want to make sure that we're being judicious with the use of our team as well as your own. Assistants, these are just easy things. Assistants, are they taking most of the impressions? Are they making temporary restorations? Of course, we want to think about what's legal in your state. The laws and rules do vary. Okay, so this is another way that we really focus in and hone in on getting our doctor productivity per hour up at the highest level, is making sure we're maximizing the skill sets of all of our teams to the fullest extent.